Well, good morning, everyone, and welcome to this webinar, which is organized by it's part of the series of webinars organized by the European Social Network and our partner, EY. And we know that there are a number of colleagues coming in, so we are going to give a minute or so that everyone can make it. And after that, we will start. And I want just I want to make sure that you all know that with Zoom you can transcribe the session, and also there is the Q&A functionality, which later on Jessica also will explain for when we have the Q&A session. As we have more and more colleagues joining, I think it's important to let you know that this series of webinars are part of the events that we organize with ESN, where we are looking at key issues that are of relevance, not just for ourselves, but also for those organizations with whom we have had a long-standing cooperation for a number of years, as it is the case with EY. And indeed, the issue of workforce, particularly workforce shortage, is an area of particular interest to our members, to the European Social Network members, and to EY. And I believe also for many of you, since we have had quite a significant number of colleagues joining us today. So I believe that now we can start the webinar. My name is Alfonso Lara Montero. I'm the Chief Executive Officer of the European Social Network. And as I just explained, the focus theme of this webinar today is to look at future-proofing social services, and particularly the question around workforce shortages, the question around recruiting and retaining people in the social services workforce, which is a very important issue across pretty much the whole of Europe. I would say this is a common thread and a common theme, no matter where you go. And for those of you who do not know the European Social Network, we are the network for public social services in Europe, with now close to 195 member organizations in 33 countries, a long-standing partner of the European Commission, with whom we have had a partnership agreement for more than 20 years now, and organizers of the European Social Services Conference, which this year is in its 34th edition and taking place in Malta at the end of May, with more than 400 registrations already today. We will also let you know a little bit more later when we conclude the webinar, and also organizers of the European Social Services Awards, which now this year will be in its 8th edition. So the question that we are addressing here today indeed is a pressing concern. When we were organizing last year our members forum, this is an event that we organize every 4 years to look at the key priorities for our members so that we can prepare the next strategy. As you can see in the graph, for 95% of them, workforce support and workforce development was a key priority. It was either very important or important for them. And this makes sense because the question around demographic trends on the one hand, but also new models of care and support, new expectations, new profiles of people who are using services are resulting in an increase, and also different way of looking at needs for care and support. Hence, attracting new people into the profession and making sure that we are developing the workforce in a different way are key to make sure that we ensure the sustainability of this sector. Some examples of our work. If I go back to the year 2016, we organized a seminar called Investing in the Social Services Workforce, on the basis of which we actually produced the same publication. And particularly at that time, we insisted in how important it was to have in place both national and a European social services workforce strategy. This has been something we've been looking on year, particularly with COVID-19 and the follow-up to this crisis with the recovery and resilience plans, we had a specific analysis of those plans to actually understand whether, as part of the responses of national governments, they included national workforce strategies in their in their recovery and resilience plans. And also, this has been a key ask that we have been insisting with the European Commission about the importance of making sure that European developments, such as the future European anti-poverty strategy, have a specific focus on the social services workforce. This was also the topic of a roundtable that we organized in 2023 in the European Parliament, with a key focus on building a resilient social services workforce. And particularly at European level, something very useful is to make sure that there is European level coordination in the recognition of qualifications, because these can make a big impact. And indeed, this is actually something that has been done within the health sector. So indeed, it's something that can be done within social work and social care. We have also been part or leading very important European projects in this area. We were part of CISWEC, which was around strengthening the skills of social workers in crisis management situations, and we were part of the production of a training which is available within this slide. And also we were leaders of the Side-by-Side project, with a focus on reinforcing prevention in child protection and addressing the needs of social workers in relation to training to have a focus on preventative approaches, working with children and families. Again, both a compendium of good practice and the report with the training needs assessment are available within those links that you've got on the screen. So some key insights from practice coming from our membership. The participation of people with experience of care in social services. This is so important. This can actually make a big impact in terms of bringing more people into the profession. We have examples of people with autism, with mental health issues being part of peer support or professional teams. Young people leaving state care, joining the inspection teams in Care Inspectorate to actually inspect their own services. This is actually something which happens in Scotland, in the UK, and has actually been explored in a couple of other European countries. The participation of people who have been long-term unemployed in social care, for example, through specific work placements. This is something that is being done in Sweden. How to attract more young people into the profession. For example, the program Care Ambassadors in England consists of a number of frontline workers who go to visit schools and colleges and to actually encourage young people to join the profession. Because actually, what the data tell us is not that it's just an issue about social care, but it's also an issue in social work as well, with less and less people joining social work universities and schools. Having in place registers for social care workers. This is very important. It's part of professionalizing the sector and is key for care workers to be able to access training. Mentorship programs, for example, for those colleagues who recently joined, it's very important to have those in place so that they are supported in this process. And regular supervision and risk management programs, because in particularly stressful professions such as child social welfare and child social workers, is key to have in place regular supervision and management support so that they feel that they are supported in the decisions that they are taking with children and families. And finally, training. And training, looking at training in all forms and shapes. For example, putting in place traineeships for young people, for underrepresented groups, for example, for travelers, for Roma. We have examples of those in child protection, but also in other forms of social work. And the use of EU funding. We are a European network. We've looked a lot at this, how EU funds can be used to train professionals on new methodologies, for example, on areas around person-centered care, or on international scales on the use of disability and others. So there are quite a number of examples there. If you have an interest in this, please do let us know. Many of them are available both within our practice library and within our publications. So this is the agenda for our 75-minute session. After this intro, I'm going to pass the floor to Jessica Chamba, who is a Human Services Global Leader with EY and our long-standing partner. And after that, we're going to be looking at a number of case studies from our membership and beyond, with Catherine Maguire, who is Head of Workforce Development at the Northern Irish Social Care Council, Corinne Hutmacher-Perret, who is Head of Fundamental Research Development and Deputy Managing Director of the Swiss Conference for Social Welfare, Emmanuel Borrelli and Samuel Menoni, who come from the Banque des Territoires in France services. So as you can see, 3 different countries, 3 different approaches, and a very, very much European and international session. I'm very much looking forward to the conversation, and now I would like to give the floor to Jessica Chamba.
Yes, thank you very much, Alfonso, and thank you for organizing and co-organizing that very interesting webcast on a topic that indeed is at the center of many questions that we are also seeing in our clients. I'm sharing my screen right now. I just wanted to focus on a few issues that social systems are facing, and that you might... Are you seeing it correctly?
We are. Just need to put it now in the presentation mode, but we are seeing.
Is it in presentation mode? Because
not yet.
Okay, good.
Now
it is. Sorry, I clicked. I thought it was okay. Now you should have it. So the social services systems are facing sustained and structural pressure that is translating into interconnected workforce challenges. And Alfonso already mentioned some of these challenges. I wanted to highlight a few others. We have a lot of workload and capacity pressure on the social services systems, with high caseload, a lot of time pressure, the rising complexity of the needs that people have to address. And therefore, this is bringing a big tension to the whole workforce system. We also have a lot of administrative burden, a lot of paperwork, heavy documentation, compliance reporting. And so the demand that we often hear is, give us more time to have with the people and less time to have on the administrative part. We also have sometimes a mismatch between the capability, the skills of the people, and the needs that we have to support the people. And we have a lot of expanding role expectations where we ask social workers to be able to support people on very, very varied needs, but also limited specialist support or uneven access to supervision, reflective practice that would make this burden a bit alleviated a little bit. We also have a lack of career pathways and of common standards that limit the visibility and the capacity to progress in the social worker sphere and to progress in social jobs, if we can say that in general. And so the need to write and move towards more consistent standards and role definitions. And also we have a complexity of navigation in the social support system in general, and the question of local access, how we can build social services also on other local public services that are present, and how to make sure that we answer the reduction of local social services access points, for example, that is rising strongly in many countries. And so facing all these challenges, what we wanted to focus on today are some examples, and Alfonso already gave some insights, but the message we wanted to carry out today is really that there is no single intervention that solves the challenges, all these challenges at once with a magic wand. This won't happen, but a coherent set of levers can fundamentally change this workforce experience and conditions. And what we want to do today is to highlight some of these levers of change. There is One aspect that we won't tackle today, but I wanted to mention it as an introduction because I know that ESN has already organized many conferences on this, is how digital enablement and digital tools and work design flexible organizations can help better and facilitate the work of professionals. And on this, for example, there is the Magic Notes solution that was awarded also a prize in the last European Social Services Awards that brings some interesting insights, for example. What we are focusing on today are other kinds of levers, like, for example, how to better support people through a better skill recognition and valorization of human resources, and how to make structured onboarding on concrete career pathways a way to project yourself in a career in the social sector. And on this, we will hear from Catherine about the Northern Ireland Social Care Council experience to see how this is helping to support people. We will also listen to an example on how to better sustain organization and to build supportive leadership and management models thanks to a caseload converter that makes it possible to better allocate the needs and the support services, and also to make it more sustainable for social workers to concretely support the people. And for this, we will hear from Corinne from Switzerland on the caseload converter that was developed there. And then another example we wanted to present is an example that is more sustaining the ecosystem and the other parts of social services, because as we say, in many countries you have local social services points are still there, but you have many local access points that are closing. And there is this ask for a single point of contact for social services requirements, and also a shared pathway, simplified referral processes, so that there is a one-stop shop for people to know how they can orientate themselves in the social system, and then maybe be, of course, supported and oriented towards a more specialized intervention. And on this, we will hear from Emmanuel and Samuel on the France Service initiative that is looking forward to supporting and to providing this one-stop access to public services in France in more local rural areas that are a bit further away from global and a lot of major social access. So these are some examples we want to be focusing on today. And we will start right now with the conversation, first listening to all these examples. Of course, we will have some time at the end for questions. So please feel free to use the Q&A part in the chat, or the chat either, or the Q&A is very useful for us. You can start using it from the beginning, but of course we will take the questions more at the end globally. And we will start with Catherine. Catherine, thank you very much for being with us today. So could you tell us a bit about the case that you have developed in Ireland?
Good morning, everyone, and thank you very much to the European Social Network and EY for the opportunity to tell you about some of the work that we've been doing to support the social care workforce in Northern Ireland. So at the Social Care Council, we are the workforce regulator for social work and social care, and for social work education and training. Our model of regulation is focused on protecting the public through the development of safe and competent social work and social care practitioners. The three interrelated pillars of our model, standards, regulation, and workforce development, are predicated on a partnership approach that supports improvement in the quality of social work and social care services delivered to those in need. Did the slide move?
No, it did before, but no, it didn't.
Apologies, I don't know what's happening here. Has it?
Yes.
Did it move? Oh, right, okay. I found a way to make it move. So we currently hold a register of just under 50,000 people, making it the largest registered regulated workforce in Northern Ireland. In NI, we have an integrated health and social care system and a mixed economy of care. So while many of our registrants work in public services, they're also employed in NGOs and in the private sector. The social work part of the register is qualifications based, meaning, and social work is a protected title. And the social work workforce has been regulated since 2005. The social care part of the register is currently role-based, and there is no particular qualification required to join that part of the register, but individuals must be working in a social care role. Compulsory registration of the social care workforce was completed in 2018, and all of our registrants are required to work to the standards of conduct and practice in their practice every day. For the purposes of this presentation, I'm going to focus on the social care part of the register and some of the work that we've been doing to promote retention and recruitment in that workforce. I'm going to share some data about the workforce before I move on to that. So you'll see from this slide that, well, I suppose to say about 82% of our workforce are female, and 50% of our registered social care practitioners are under the age of 40. I'll come back to that later. More than 90% of our registrants work in adult social care, in adult services, in residential and home care. We're seeing an increasing number of social care practitioners working in children's services, and a recent review of children's services recommended a greater skill mix there, so we're likely to see growth in that area in the next few years. One of the benefits of maintaining a register is that we can, gives us an insight into movement in and out of the workforce, and we're able to track leavers from the workforce over time. So you'll recall that I said that about 50% of our registrants are under the age of 40, but we can see from the leaver data on the screen that about 60% of our leavers are under the age of 40. So we know there's more churn in that age group than in the older age ranges. And despite that churn, we know that about 53% of social care practitioners have stayed on the register for 5 years. I'm going to say a little bit about the kind of political context to the reform of adult social care or social care in Northern Ireland, just to kind of give you that context. So you'll see on the screen the numerous reviews that we've had over the last 15 years that have highlighted strategic, structural and operational challenges in our systems and services. And while there are benefits to our integrated health and social care system, it's proved difficult to balance the demands and needs of the acute hospital sector against the delivery of social care, and acute hospital sector is often prioritised in that context. Our social care system, like many others, is under enormous financial and resource pressure, and we have waiting lists far in excess of other parts of these islands. In addition to that, we are a post-conflict society, and we have higher levels of need than other places, and we have not had the benefit of stable government over the last 10 years. In fact, the author of the Children's Services report on the screen there suggested that the political vacuum had a harmful impact on children, families, and increasing poverty, and on services provided within public and NGO sectors. Social care sector, in Northern Ireland, like other places, continues to face significant challenges around working conditions, qualification completion, and professional development, all of which impact on recruitment and retention. And until recently, like other places, we have struggled to grasp that nettle of reform. However, all of our political parties agree on the need to reform social care, and we've seen greater government support for that in the post-pandemic period. So, just move it on again. So as part of that reform process, the Department of Health Office of Social Service in Northern Ireland asked the Social Care Council to bring forward proposals for a qualifications-based register, a career pathway and a continuous learning framework for the social care workforce. We had experience of supporting continuous professional development, as we are the awarding body for the CPD framework for social work in Northern Ireland. And as I mentioned earlier, our model of regulation is based on formal and informal partnerships with stakeholders. So we worked with a subcommittee of our board, the Leaders in Social Care Partnership, to develop the proposals. And while our experience of partnership and working collaboratively was a strength, in 2020 we had to pivot quickly to collaborating in an online environment. and our existing relationships were useful to us there. We also sought to build our capacity in applying a service design methodology with support from a London-based university initially and then a local design company. And I know that others have used this approach, but for those of you who haven't, this approach uses human-centered methodologies that ensure collaboration and co-production are integral to the project. And we followed the four-stage process on the screen of discovery, design, develop, and deliver. Our team engaged widely across the sector with employers, managers, frontline staff, service users, the service regulator, government departments, to develop the architecture to deliver a qualifications-based register, continuous learning framework, and career pathway. We also commissioned a number of evidence reviews as part of that discovery phase, one of which was in relation to retention and recruitment of social care workers. And I suppose that evidence review reinforced some of what we knew. And Jessica, you mentioned at the outset as well that there's no single solution to retention and recruitment challenges in social care sector. Research on the evidence of retention strategies is fairly limited, but the review did highlight some good practice in aiding retention. And a number of the areas on the screen are a focus for my organisation, for social care employers and others. So, for example, we developed a values-based recruitment toolkit for social care to support recruitment into the sector. With support from our sponsor, Department Health, we developed a Social Care Making a Difference campaign that highlights the important roles undertaken by social care practitioners in our society and promotes social care as a positive career choice. The terms and conditions issue has proved more difficult to progress. A Fair Work Forum has been established in Northern Ireland and is seeking to move towards the real living wage as a minimum for people employed in the social care sector. I suppose the more recent Skills for Care report in England reinforces these messages and found the top three of the top 5 factors that impact on retention are being able to access training, having relevant qualifications, and being paid more than the minimum wage. And the last point highlight on the screen, I suppose, brings us back to the work that we were asked to do by the Department of Health. In the discover and design phase of the project, it was really important that we understood the experience and aspirations of practitioners on the ground, of their managers and leaders in the organisation. And this slide captures some of the messages that we heard from frontline practitioners. There was a perception of social care that practitioners were not interested in qualifications or learning and development opportunities. And through our engagement with frontline staff, we surveys and focus groups, we heard a really strong message to the contrary. They were interested, and they were interested in qualifications and learning opportunities because they wanted to be better in the role that they undertook. And some were interested in progression as well. We also were able to better understand the barriers to learning opportunities for frontline staff. That included lack of opportunity, paid time to learn, backfill for their role, and understanding how to access either qualifications or learning opportunities. You'll see that quote on the screen. I didn't know where to go to develop my career. It wasn't clear to people. And again, the Skills for Care in England 2025 report, the state of the adult social care workforce, reinforced that message that continued investment in staff training can positively impact on retention rates. So we used all of that learning from evidence review and consultation widely across sectors to develop what has become the Care and Practice Framework and an entry-level qualification for social care practitioners. It was very much an iterative process. In fact, I think there are old versions of this framework out on the internet somewhere that involved prototyping and constant checking with stakeholders in the sector and the Department of Health as our funder. So the Care and Practice Framework that you can see on the screen is designed to support social care practitioners to develop by providing 2 interlinked pathways. On the left there's the continuous learning pathway supported by mentoring and supervision. And on the right, a qualifications pathway to support career progression that commences with the new Level 2 certificate that was developed in safe and effective health and social care practice. And you'll see the arrows that, it's not an either or pathway. They are interlinked pathways that people can weave their way through. I suppose our view is that from using that service design methodology, we've been able to develop a framework that has been embraced by the sector, and the sector have a very strong feeling that they were part of the development of this. Taking the time to listen, develop and deliver has resulted in a framework that we hope will support the development of a resilient, values-based social care workforce, continuously evolving to provide the best care and support to service users now and into the future. Leaders in the sector told us about the resource required to service induction for new entrants in the workforce with a significant level of churn. Their induction qualifications also were not portable from one employer to the other. So the Level 2 certificate has, suppose we hope will help to resolve that problem. And you'll see that standards and values are at the top of that list in terms of content, which is about person-centered care as well. The employers and new entrants now have access to an accredited certificate that's portable across employers and is a first step on the qualification ladder for staff. The certificate will become mandatory at a point in the future that will be agreed with the Department of Health, but is currently available and is accredited through our qualification regulator in Northern Ireland as well. And some of the feedback, so we ran a pilot of the qualification so that we were in a better place to support employers to make it available. And you can see employers comment on the increase in confidence in staff and the fact that values is embedded into the qualification. And the practitioners or learners who completed it, you can see an intent to stay in their comments, maybe want to do more, want to progress in my career. And that was really important for us to consider as well. So while the developments to date have been really important, there's much more to do in the retention and in the recruitment and retention of social care. In December 24, our Health Minister launched a 10-year social care workforce strategy that includes implementation of the Care and Practice Framework and the Level 2 certificate. The vision of the strategy is closely aligned to the purpose of the Care and Practice Framework, and the 7 priorities within the strategy include social care as an attractive career, social care practitioners being recognised and feeling valued for the work that they do, and having access to qualification and learning opportunities as appropriate to their role. And that strategic alignment for us is important in supporting the next stages of the implementation of the Care and Practice Framework and the Level 2 certificate. We are still at relatively early stage in the outworkings of that strategy and in the implementation of the Care and Practice Framework and Level 2 certificate. When you think of the scale of this workforce and the diversity of roles in which they work, there's a lot more work to do over the remaining 9 years of that strategy. We were, though, really grateful that our Minister of Health on the screen there presented the certificates to the Level 2 to the people who completed the pilot of the Level 2 certificate. And we are also very grateful that our work was recognised at the European Social Services Awards when we picked up the Innovation Service Award. So that's my presentation. I'm going to stop sharing and hand over to someone else. Apologies for the technical issues there.
It was very clear and we could see it, no worries. And thanks a lot. Very interesting scheme also. And yeah, I like the arrow thing to see that it's not a single way, but it can go in different ways. And of course, the design methodology also is very interesting. We can come back to that later. We will now move on. And of course, as I said, please feel free to ask your questions if you have some. If we can't answer all of them today, we will definitely let them also go to the speakers for them to get in touch with you. But now I'm moving over to Corinne Houtmara-Perret from the Swiss Conference for Social Welfare. Corinne, if you want to take the floor and share us your presentation about the caseload converter.
Thank you, Jessica. Do you hear me?
I hear you. I see you.
Okay, fine. Then I'm trying my way to share this way. Do you see now the presentation?
Perfect.
Perfect. So I did it. First step done. So I'm very thank you for the invitation, and we're very proud being able to present the work we've done the last about 10 years. This caseload converter called this calculating workloads in social services in Switzerland. So this calculator for a sustainable workload and staffing in social welfare is the result of over 10 years studies and experiences done. The principal question was how to prove that for well done social work, the professionals need time to fulfill their task in a sustainable manner. Then only with a reasonable drop load, the social welfare recipients will be better advised and supported, and the social worker will have a better overview of the cases they're handling. So to avoid a situation like the one on this picture. This was the aim. In my presentation, I will first explain how social assistance is in Switzerland functioning. It's a little bit a special one, and which is the role of our association, the SCOS, the Social Conference of Social Welfare. And then going on the scientific findings we did the last 10 years, and then to present in a few minutes this caseload converter, how it works, how should works. So the organization of social assistance in Switzerland is in this way special because social assistance supports people who have no other sources of income and advises them with the aim of stabilizing their lives and, where possible, helping them regain economic independence. The special part of it in Switzerland is that this social security system is not controlled by the federal government. In other words, there is no national framework law for social assistance. The 26 cantons in Switzerland are responsible for social assistance and therefore regulate the eligibility requirements and organization of it. This means that there are at least 26 different regulations governing the provision of social assistance in Switzerland. That's why our organization is so important. The SCOS is a professional association founded in 1905 by social workers. It plays a coordinating and harmonizing role in this system. The SCOS recommendations and guidelines are followed by the vast majority of cantons. All 26 cantons and over 500 municipalities and cities are members of our association. And many representatives of social services, federal agencies, and aid organization work in the commission of the SCOS. This one you see here and here. So the question was, how can the staffing requirements for a professional social counseling and a sustainable social work be demonstrated? This was the burning question in the social welfare at the end of the 90s. The number of cases and costs in social welfare were rising, and social workers were overloaded. Up to 140 cases had to be dealt with for a full-time position. The term cases refer to the support unit consisting of one person or an entire family the social worker has to counsel. With a caseload of 140 cases, the social workers were just putting out of fires and feeling frustrated. That's why the city of Winterthur commissioned the Zurich University of Applied Sciences to investigate how reducing the caseload per social worker would affect the system. This scientific monitoring of the pilot project lasted 2 years, from 2015 to 2017. In a group of counseling social workers, the caseload was reduced to 75 cases for a full-time position, so half of the usual amount. The professor responsible for the project, Miriam Ezo-Davoglio, is present at today's webinar and can also answer questions or take part to the discussion. This pilot project was evaluated in 2021 by the Office for Labor and Social Policy Studies, called BAS. The pilot project found the findings were that thanks to the additional time available for counseling, the social welfare recipients received more intensive counseling. The social welfare recipients were replaced more sustainably, a higher redemption rate. The costs of social assistance were reduced, a reduction in monthly case cost. Unfortunately, this was the most discussed point, the reduction of the costs. But for us, the professional, the other indicator were the most important and interesting. Then for the social workers, they were more satisfied with their work. They had an increased effectiveness of social work activities. And the social workers had a better overview of the cases they were handling. And another positive effects on the frequency of absences due to illness and staff turnover was demonstrated. So with these studies and this pilot project, the return on investment was proven and the city of Winterthur hired more staff. But although the results of the Winterthur study were followed with a great interest by individual municipalities and cities, it became apparent that in order to justify increased staffing requirements, something else, something like a calculator was needed in addition to the scientific findings. That's why the SCOS, our organization, commissioned once again ZHAW, this Zurich University of Applied Sciences, and the Office BAS to develop a calculator. 10 cantonal social services and 21 municipal social services took part in the project. So they give their experience and their needs in this developing the calculator. I will briefly explain you how this calculator works. It's an Excel spreadsheet with 9 tabs. The aim is to enable each social service to calculate, based on its current staffing levels, whether it can carry out its work within a reasonable range. The calculation is made for 2 areas of social services: the economic social assistance and the child and adult protection services, because social services in Switzerland do, not all, but a lot of them are doing both. So the community have the social assistance and child and adult protection service in the same service. There is an input and then it's an output. each area has an input tab, and the resulting is in an output tab shown. And to show also, there is a spreadsheet with some quality indicators, so that the services can put on also quality indicators. I will explain them next. So the calculation is based on the number of cases and the number of social worker. This is the base of the calculation. The resulting range is then influenced by the services staffing organization, namely whether the social workers have to do everything, including extensive administrative and legal clarification, or whether they are relieved of this by other staff like administrative or specialized support. The calculation in the output tab shows whether the social services is within an what we say an acceptable range with its existing staff or not. We are then our recommendation, or the one of the calculator, is when a social worker has a low level of specialized support, then the range should be of 40, maximum 60 cases for a full-time job. And when the social services is in a way organized that there is a significant level of specialized support, then the range might be within 60 or 80 cases for a full-time job. So you see here this input-output range table. Then the services see that with a 54 cases, it's in the range that is recommended and said as acceptable. I'm not going through the Excel spreadsheet. It's too mathematic. I explain you how it works in the system. And then the social services has the possibility to note some quality indicators, which are also having a quality, are changing or having an input also. Sorry, my English is not so well. And these quality indicators provide additional information on the personal structure, such as the qualification, as we heard of Catherine. It's a very important information, and which organization the social services has it some division or counseling setting, or has it a reorganization going on. And this is also something that charge the people, the social workers. So with this tool and the scientific results, social services manager can then justify the necessary personal resources to their authorities on a scientific and a methodological basis. The fact that the SCOS has had this calculator developed is a guarantee of quality. We note that the results of the Winterthur study and the development of the caseload converter have become a talking point in job searches. Social services are promoting it, and social workers are asking for it. I put also on the presentation some links to the studies who had been made. It's in German, but I think then you can also read it. So you see what the work has been done and what were the publication of the last years. And also in the presentation, I think you will then receive are not only my indication to get in touch, but also of the research of Miriam Esa-Daviole and Dominique Höglinger, who made the calculator. So you have possibility to get in contact with them. Thank you for your attention.
Thank you very much, Corinne. And indeed, this reminds me that I have not said that. Of course, the presentations will be available to all to you after all, and also the recording. I think this presentation is interesting. A lot of social services organizations, because these questions of how to measure the workload and better organize the work is a very central question. I'm moving on now to our third example, and then we will start the discussion. So to Emmanuel Borelli and Samuel Menoni from the Banque des Territoires in France, and they will be speaking to us about this experience of redesigning the France Service, which I think is going to be also of a lot of interest to most of you. Thanks a lot. And Emmanuel, Samuel, it's fine. I already see your screen.
Perfect. Thank you very much. Good morning, everyone. Thank you very much for this invitation. I'm responsible for digital inclusion and public services at Banque des Territoires. Banque des Territoires is an institution in charge of France Service Programme, and it is a public institution that helps, in particular, local authorities and administration to develop public action in France. To start, we would like to briefly explain the public policy context behind France Service Programme. Over 10 years, public service in France have undergone a major transformation. First, we have seen a progressive digitalization of public services, with more and more procedure moving online, and at the same time, access to service became too distant and fragmented. In last 2018, the Yellow West social movement highlighted a deep feeling of distance between citizen and public institution. This crisis acted as a trigger and led to the national public debate, where access to public services appeared as a key concern. As an answer, the French government created the France Service Programme in 2019. The first goals were clear: to develop 2,500 France Service Centers across the country at 30 minutes away for every French. Every center must follow a very specific charter, at least 2 agents by center, open to public for a minimum of 24 hours a week, a private space to receive the people, and free access to computer. France Service was designed as a one-stop shop, bringing together initially 9 national administrative paperwork in one single place. The idea was simple: reduce complexity for citizens and make public services more human and more accessible. Other key principle was skills pooling. Civil servants are trained to support a wide range of different administrative procedures, which allowed to increase efficiency with limited human resources. Now that we have seen why France Service was created, let me explain how this policy is organized and who is involved in it. France Service is built as a stronger multi-actor ecosystem. At the national level, The ANCT, the National Agency for Territorial Cohesion, is the main public authority in charge of the program. At the local level, we have prefecture. Prefecture play a leading role because this is a decentralized policy. They ensure proper development, quality standard, and coordination across territories. They are also the main interlocutor for local project leaders. Banque des Territoires act as a strategic and financial partner of this policy. Between 2019 and 2022, Banque des Territoires contributed by supporting the animation of France Service Network, financing the training of France Service advisors, and in France Service Network, financing more than 100 buses and contributing to France Service digital platform. This platform used to measure activity in France Service centers. France Service locations themselves are mainly carried by local authority, but also association and operators. This shares governance model is one of the strengths of the program, but it also creates new coordination and capacity challenge. So where do you stand today? Let me now share a snapshot of France Service as it existing today. Today, France Service has reached a very significant scale. We currently have 2,864 centers with a goal to reach 3,000 locations. Around 45,000 users per day, and high user satisfaction rate of 99% today, and 12 national public operators now involved in. These results show that the program works and that the citizens trust it. However, success also created pressure. France Service now deliver around 1 million accessed procedures per month, and attendance keeps increases. The main limit of the current model are not longer human commitment, but places and equipment themselves. Many locations are not originally designed to absorb short volumes, ensure confidentiality, or support new services. This leads to a key question: how can we do better with the same or even fewer human resources? This question pushed Banque des Territoires to involve its partnership and tools. This is where the initiative Lieux innovants, lieux accueillants comes in.
Thank you, Emmanuel. So in 2023, Banque des Territoires launched the call for project Innovative Spaces, Welcoming Spaces, or Lieux innovants, lieux accueillants in French. The objective is very clear. This program is not about hiring more staff. It's about changing how services are delivered by improving the places where professionals work and where users welcomed. Between 2023 and 2027, the ambition is to support 1,000 France Service centers and transform them into exemplary spaces, more welcoming, better organized, and more efficient. To achieve this, 50 million euros has been committed by Banque des Territoires. This support mainly targets local authorities and associations which manage most France Service centers. Each selected project benefits from a 6-month support program, fully funded and based on 3 areas of expertise: architecture and spatial design, with designers and architects including experts of UI, precisely, to improve layouts, signage, confidentiality, or accessibility. Service design, finally, to clarify services, develop partnerships, and better respond to local needs. The idea is simple. Better spaces help staff work better and help users become more autonomous, reducing pressure on human resources. So after several years of implementation, we can now look at concrete results and measurable impacts. Today, the results of this program are already very tangible. Almost 500 France Service centers have been selected. 43 centers have already been fully transformed, and 110 are currently under renovation. All of this including mobile France Service buses and overseas territories. But beyond these numbers, what really matters is the impact on daily work. An impact assessment survey shows a clearly improvement in the quality of working life for advisors, better layouts, more suitable premises, and spaces designed for confidentiality and calm interactions. Advisors also report that they can carry out their missions more effectively thanks to premises adapted to their real needs. Another key impact is the better management of visitor numbers. 2/3 of the France Service surveyed noticed an improvement in user flow, even when this was not their initial objective. In the context of a workforce decline, these results are crucial. Better organization reduces overload, stress, and inefficiency, making social service more sustainable over time. These impacts are not only visible in data, they are also expressed by people on the ground. The feedback from France Service stakeholders clearly illustrate the value of this approach. Local elected official highlights how the program helped them to go further in transforming local public services through collaboration with residents and staff. Managers underline how rare and valuable it was to have time to step back, ask the right questions, and reflect collectively, something often impossible in daily emergency-driven work. This is a key point when we talk about workforce decline. Creating moments to rethink work organizations helps prevent burnout and reduce turnover. Local partners also stress that coordinating outreach activities with France Service increases visibility, strengthens cooperation, and improves support for vulnerable populations. Innovation here is not technological only, it's organizational, spatial, and human. To make this impact last, the program also focuses on sharing and scaling up these innovations. So in the medium and long term, innovative spaces, welcoming spaces goes beyond individual projects. One key ambition is to create a resource center for all organizations running France Service, especially those that lack time and capacity to innovate. This resource center provides practical tools, specifications, training path, or inspiring example from transformed France Service. The goal is to spread good practices across the entire network, even beyond the funded projects. So to conclude, I would like to leave you with this message. Through this call for project, the Banque du Territoire aims to ensure that France Service become laboratories of innovation. And in the context of workforce decline, the challenge is not to do less, but to work differently and to work better. Thank you.
Thank you very much for this very interesting presentation, opening also to other actors around our local social service actors, but that have a lot of impact because we know that to deliver the service on the ground, we have to be connected with all these other public agencies that are on the territories. So we have a little bit less of time for our questions and answers, but we will try to keep it as short and interesting as possible. Alfonso, maybe first your reaction a little bit to what you heard, and also regarding your perspective from the European Social Network, the voices that you're regularly hearing about the 180 social services providers that are working in the network. I know that you are talking a lot about the challenges, but maybe what are the key trends that you see in how social services are responding to the challenge of recruitment, retention of personnel? Do you see some key trends that are emerging at the moment?
Thank you, Jessica. Well, very interesting presentations, and as you were saying at the beginning of the session, very much showing different ways in which different countries, different cultures, different approaches, trying to address some of the issues. Because as you were saying earlier on, we need overarching strategies, and I think one of the main issues that we have seen over the years is that social services are doing what they can, but I'm not sure whether governments are doing enough. I think governments themselves, they should provide a framework for the issues that we are facing around social work and social care, broadly understood, social services. Sometimes we see some focus on social care on the one hand, but not on social services or social work on the other. But actually, many of the challenges we are seeing now, at the beginning, some years ago, I remember in 2016, 17, they were affecting pretty much social care. But now social services, social work specialists, social services are actually facing some of the same issues. And as I explained earlier on in 21, we looked at the recovery and resilience plans because the idea with this funding coming from the EU was that governments were investing in actual reforms, not just in projects. And unfortunately, there was all these, talks around so important social care, social services that have been so important. They were neglected because, the focus was on healthcare. But the reality is that governments themselves were not really putting forward clear and ambitious proposals to address the sector. And because you don't have that frame, social services can do what they can within the framework that they've got. And I really think that what we need here is courageous and clear and overarching policy frameworks on the part of governments to support social services to be able to put in place and to be able to be backed up and to be supported in the many strategies that they are putting forward, some of which we've seen today, some of which I've mentioned, with the 3 practices, some of which I've mentioned earlier on as well, in relation to the practices that we have identified. Because what we do have is a situation where both we have not enough retention and not enough recruitment. And also, even when it comes to specialist social services, social work, we are seeing less and less people going into studies as well. Mm-hmm. So the challenge is not small indeed, but I also think that the policy framework is not there to back up those who are actually doing the best they can to improve the situation in terms of recruitment and retention within the sector.
Okay. Well, thank you for this global vision. Maybe I will come back to our speakers and presenters and ask you, maybe we can do a bit of a mixture of the questions we wanted to address in this discussion. Could you please tell us how your project, how you have seen that this has impacted the quality of life at work of the professionals, and maybe how it has helped you or your social services that you're working with to retain these professionals in their positions? But also maybe tell us if you have one suggestion or one idea on how you would give out to our colleagues here today what they could do and what they need to do when they want to embark in such a change program like what you have just presented. So maybe I'll start again in the same order that we had, Catherine.
Thanks, Jessica. I think I suppose the approach that we have taken was to engage with the workforce and to understand the issues from their perspective, so that when we were embarking on a significant change process, we had their agreement to it, and we were bringing them with us, and that they understood the purpose and direction of travel in relation to the work that we were doing. I think the other thing, I think there are two things. I think the strategic alignment with government policy and direction was important for us at various stages of the process, and keeping close to that direction of travel in terms of understanding where social care reform was going in Northern Ireland, and what our organisation's responsibilities were to support that was important. And I think the other thing is to say, in our change process, we had a relatively small team, and we didn't have a large budget. So, I mean, I think sometimes thinking about those things holds people back. It probably meant that our progress was slightly slower than it could have been otherwise. But if you have the right people and a committed team and a direction of travel, you can commence your work and begin to make changes without a huge budget or a large team. I'm not sure if that answers, Jessica, what you were getting at or not.
Yeah, but you're saying, so basically, if I sum it up, a very participative way of building the project, and you mentioned you also used some service design to do that. So that was one of the key attention points. And the other one is, don't be afraid if you don't have a big team and a big budget, you can do it.
Don't let that hold you back.
Don't let that hold you back. Okay, thanks. Corinne, what would be your insights, learnings, and maybe also the how this has helped you retain some professionals?
It goes in a certain similar way as Catherine now told. In Switzerland, we are bottom up people and politics, so bottom up and not centralized like France, for example. So when we want something and when we need something, then we have to do it in the communities and in the social services. And that's why we also, in this study of Winterthur, it's a bottom up. It's coming from the social services, the needs, and then we take the people together. And so we developed this caseload converter. And I think what Alfonso told also, the politics have a great responsibility in it, and how to it's also the question is how to make them shown that there is something to do. And this is one of the big forces we have when we participate from bottom up, and to show the legitimacy of what we need. So it's a constant discussions with the politics, and social worker has to know that they have to be in this constant discussion with the politics, not only working in the social services, but being in these discussions with the politics. That's very important. And the participated way for project, also we had not a big budget, but because we had 10 cantons and 21 over 30, it was at the end 30 social services developing this caseload converter with us. It was the great fortune of our project. This would be so I don't know if Miriam Ezer Daviolo, I know she's there, if she wants to say something, but we can maybe
I think it's not, if she's not with you, I think it's the mics are not open, but she can of course contribute in the chat potentially. No, very interesting, and I mean also good to have in mind that everything social workers are doing, of course, for the public, also has to be understood by the politicians supporting the service, so that the direction is clear where we are going and why all of that is important for bettering our global public service, let's say. And from your side, Emmanuel and Samuel, what results do you see on how this helps retaining professionals, and what is the lesson you would like learned or you would like to share?
Yeah, like Catherine and Corinne said, and this is the approach, the design approach that we use in Lieu Innovant de l'Accueillant to address these challenges. I think we have effectively we need to start with team needs, encourage the collaboration without overloading. Optimize existing spaces, especially in the case of France Service. Leverage local partnerships, and finally, and it's very important for us, measure impact, especially to adjust as needed, act or everything else, we think. And the objective is clearly to build a collective dynamic and focused on the practical improvements of people.
Yeah, concrete improvements. So innovative design methodology centered initiatives that make it able to have people participate, but also measure impact, which links also with how we show the impact also to the politicians supporting the system and so supporting the transformation. These are some key aspects. And I see time is flying by already. So I think it's time for Alfonso already to conclude, but I think we have some levers and ideas on how to try to address this challenge, which is a very important challenge for the sector. And maybe Alfonso, I'll let you conclude for today.
Thank you very much, Jessica. Indeed, I mean, time flies, and this was a very interesting conversation, very interesting practice examples coming both from our membership and from other colleagues outside. And indeed, I really think, as you were saying, there's just not one way to address this, and we do need a comprehensive set of measures, but I do believe that this backed up by policies is very, very important. But there are a number of enablers there, which we thought is important to highlight as we conclude, particularly the register of care workers. And this is very clear what Catherine explains, that shows it all. And indeed, it was an example of good practice, very well valued by those evaluators at the awards, because indeed it does show that it has actually have an impact. So it is very, very important. The question around attracting newcomers, attracting young people, men, particularly to social care, it is essential to attract men to the profession and the represented groups, those with sensitivities to the issues that we are talking about, those who have experience of care. All of those are needed in the profession. We need them. And we need to have campaigns run by government together with those in the profession to make sure that they come to us. Training, whether they are traineeships, placements, mentoring, on the job, lifelong learning, all of those in a comprehensive training strategy from the very beginning to, when people have been in the profession for a long time, they need to be part of a wider workforce strategy. Having in place adequate supervision and management has been said very clearly by our colleagues as well. And of course, working in partnership, because indeed this cannot happen alone. And we need those in the sector working in partnership with other professionals. We'd like to also mention that we are now 3 months, isn't it? Now 3 months and a half ahead of our conference at the 34th edition of the European Social Services Conference, where we're going to be looking at how social services systems are managed across different countries. And we've got a set of excellent practice and quite a very strong program of technical sessions of more than 75 proposals, plus a number of plenary sessions. And we are very much looking forward to welcoming you all, more than close to 400 registrations already, and very much looking forward to welcoming everyone working in social services. And there you've got, if you want to have a look and find out a bit more. I'd like to thank everyone for being here today. I'd like to thank Jessica and colleagues at the office, Arianna and colleagues for preparing this webinar. And of course, I'd like to thank our speakers for being with us today, Catherine, Corinne, Emmanuel, and Samuel, and everyone else who's been accompanying today. Thank you very much and have a lovely rest of the day.